they have to face a lot. And what we have found out, they have a lot of difficulty in breathing, sometimes in talking. Speech also takes a problem. And that's why we at Apollo Proton Cancer Center thought we should come up with this initiative. For us, rehabilitation matters and recovery matters. For us at Apollo Proton, treatment ends, care begins. And that's the idea why we feel we should be going in for a clinic like this. C-VASC brings together specialists across oncology, ENT, speech and swallow therapy, so that patient gets everything under one roof. By combining advanced diagnostics, innovative treatments, dedicated rehab support, we aim to help patients reclaim essential functions. Importantly, the clinic will also serve as specialized center for professional voice care, supporting singers, dubbing artists and broadcasts. This initiative is another step in Apollo Proton Cancer Center's journey of redefining cancer care. Thank you once again to everyone who's present here for being a part of this initiative.
Thank you very much. Thank you. And thank you all for joining today. I think as Karan pointed out, it's a very, very important day for us. And we actually are committed to making sure that the patients who come to us for treatment not just go back well, but they go back thriving. So they go back and do whatever they wanted to, and that is our commitment. So today I was not expected to be here, but I just landed up, so I thought that I must take this occasion to moment to thank you all, that because whatever we do, unless it goes out in the public, it's communicated well and the people believe in that the real uptake doesn't happen. So I think you play a very important role in taking this message that cancer today has come a long way. While on one side the numbers are growing, but the other side the treatments are growing better, and we have more and more varieties of treatment, and therefore the questions of better quality of life are more alive than ever before, and that is why that is at the center of all that we do. And it's a combination of teamwork, as pointed out repeatedly, that today healthcare is a team sport and oncology is the apex of that. It's the ultimate pyramid. There's nothing as more complex which requires so many people to come together and deliver to one patient at each touch point. So that is what we are committed to, and once again thank you Karan and thank you team for being here. Thank you.
Yeah, very nice to see all of you here. You'll have to excuse me, நான் தமிழ் கத்துக்கிறேன், ஆனால் fluency இல்லை, so இன்னைக்கு English பேசுவேன். So let me just explain that head and neck cancers are the most common cancer amongst Indian males. They require our complete attention, and focus to improve the results and improve the quality of life of patients. So not only do we want our patients to survive longer, we want them to survive longer cancer-free, and we want them to live their life they all have a role, right? They have a role in life. That role could be of a parent, of a spouse, of somebody who is a breadwinner, somebody who is a student. So we want them to go back to their role in life. And when we want them to go back to their role in life, then all the functions, whether it is presenting themselves to society, talking, eating in public, eating with their family, each of these things is very, very important. Very often when patients are treated for head neck cancers, we ask them, are you able to eat at a wedding? Because that is critical. In India, a wedding means slightly spicy food. It means maybe something which may also be crisp or slightly pointy. So are you able to swallow that? Have you recovered your swallowing functions? These are all the finer details that ensure that a patient has made full recovery after treatment. So as you know, Apollo Proton Cancer Center is the first proton therapy center, not just of the country, but also of South Asia, Southeast Asia and Middle East. It has been our privilege and responsibility to bring this technology into the country and to improve the quality of life of the patients, to improve the outcomes. That is what we have seen, and that is some result we are presenting in Astro a little bit later. In September in Boston, we are presenting the results of our experience at the Apollo Proton Cancer Center of improved quality of life, better quality of life, and better outcomes. We have many firsts to our credit. One of them is, of course, proton therapy, but we also there are very few dedicated cancer management teams, but at the Apollo Proton Cancer Center, we have dedicated cancer management team, and today you will be meeting the head neck cancer management team. When we talk about head and neck cancer, there are other things besides proton therapy or good quality radiation, like surgery, reconstructive surgery, transoral robotic surgery, personalized systemic therapy, and all these are something that we strive to provide to our patients at the Apollo Proton Cancer Center. Now, a special mention about voice and swallowing preserving treatments. You will be hearing Ms. Aarti Soman, our swallowing and speech therapist, who will be talking about this, and then of course my colleagues in the head and neck surgical branches who will be discussing what we do here. As a radiation oncologist, I'm really happy that voice preserving treatments have been, radiation has been an integral part of voice preserving treatments. So for laryngeal cancers, for hypopharyngeal cancers, when we give radiation, and if for advanced disease, when we give radiation with chemotherapy, patients are able to avoid surgery in most situations. And that is, again, a very satisfying thing as a head neck oncologist, that they are able to cure the cancer and maintain the normal pathway both for breathing as well as eating. That is, of course, one small component. There are many other components of prehabilitation and rehabilitation, and today we have gathered here to understand how these can improve the life of patients and how the C-VASC clinic will be a concerted effort to do so. Thank you once again for being here.
So basically, breathing, speaking, and eating are basic functions in a human. So any of these qualities, when affected, it impacts our quality of life. So in a head and neck cancer patient, about 80% of these patients have one of these functions or multiple of these functions affected at any point in their life. Voice, airway, and swallowing, they all are interconnected because they are all having similar structures playing their roles are being divided into the same structures. Now in the voice box, what does it do? So it opens and it closes, as in this seen in the picture. It opens and it closes when we are speaking, we are eating, and we are breathing. So the main function of the voice box is preserving the airway, because when we eat, when we swallow, there are possibilities of the food particles to enter into our airway, which we generally perceive as choking. And also the secondary function being sound production or the voice. Now what are the signs or symptoms, or how does the patient come and tell us that they have difficulties? So when a voice patient come to us, they generally have complaints of hoarseness of voice, strained voice or weak projection in the voice, and breathiness or complete loss of voice. When an airway is having a trouble, they usually complain about shortness of breath, chronic coughing, wheezing, noisy breath or stridor, and recurring choking sensation. In case of a dysphagia or difficulty in swallowing, generally the complaints are pain while swallowing, food or liquid getting stuck, throat clearing frequently, coughing during meals, and nasal regurgitation. Now what are the causes of all these problems? Majorly, the voice, airway, and swallowing complaints can arise in head and neck cancers, neurogenic disorders or tumors, structural obstruction caused by benign growths, and inflammation or reflux. In a head and neck cancer, generally these problems can be impacted upon presentation when the tumor shows itself, or as part of a surgical procedure, or while undergoing the treatment, or as part of post-treatment. So in the pictures you can see some of the tumors. These tumors can impact the closure of the voice box, impacting the voice or breathing and swallowing as such. Commonly in head and neck cancer, the tumor location is very important when we are deciding on how to intervene or how to manage the problems. So tumor location generally when it comes to a voice box tumor or somewhere in the throat majorly impacts the swallowing function and also airway. Problems with tongue, when the tumors are around the tongue or the back of the tongue or anywhere in the oral cavity, they have a bigger problem when it comes to the speech. Now the surgery actually impairs or changes the structure of the oral cavity or the throat. So that can also have an impact in the swallowing function. Now radiation and chemotherapy, as ma'am mentioned, we are having advanced radiation and chemoradiation. So most of the patients have some amount of edema or swelling that can impact from the treatment, which can cause some amount of airway problems or swallowing dysfunction. Who is a professional voice user? So professional voice users are people who use their voice for their career. Now they are basically singers, actors, dubbing artists, news anchors, attorneys, radio jockeys or call center staff. So a voice health is basically critical for these people when it comes to their job.